Healthcare Policy Analysis, H.R. Bill 354, Defunding Planned Parenthood by CDennis. As this is a controversial analysis, we'll start with a few different problem statements that can be considered. The first and most practical when viewing the bill from the Republican standpoint would be, will defunding Planned Parenthood result in a decrease in illegally funded abortions? Some alternative problem statements would be, will defunding Planned Parenthood result in an increased rate of unintended pregnancies, or a rise in sexually transmitted infections, or devastating loss of healthcare services for millions of men and women? For those who aren't as familiar with this healthcare policy and this bill that is currently in the House, I'll give some basic background knowledge, important to know, kind of from all points of view. And definitely don't want to enter this as being biased by any means, so bear with me. Elective abortion is not covered by Medicaid. That's a known fact and has been such for some time now. Special case abortions, such as those needed as a result of rape, incest, or those that would result in life-threatening dangers to a mother or unborn child, are covered by Medicaid under the 1977 Hyde Amendment. On January 6, 2017, the Defund Planned Parenthood Act of 2017, thus the bill H.R. 354, was introduced to the United States House of Representatives. The intent of the bill was and is to provide for a moratorium on federal funding to Planned Parenthood Foundation of America for at least 1 year from its passing. Since being introduced, H.R. 354 has since been referred to the House Committee on Energy and Commerce. The proposed act to defund Planned Parenthood has been fueled by reports of deceit regarding the allocation of federally awarded funds to cover the cost of elective abortions rather than awarded to solely cover preventative services such as cancer screenings, contraceptive counseling, and those kind of things. Mammograms, anything that can be offered in the Planned Parenthood facilities. Planned Parenthood has been able to file for reimbursement for Medicaid funds for non-abortion services such as those things I mentioned, but the ability of the funds to be fungible, such as it all enters one pot and it's not as feasible for someone to be able to tell where exactly the money goes, has given much hostility to the entire issue and debate, thus leading to ethical debates, moral debates, pro-life versus pro-choice, liberal versus conservative, a debate that I think we're all very familiar with. So the big picture here really is by pulling all Medicaid funding from Planned Parenthood, including that for which it's only at this point technically supposed to be used for, means that no Medicaid patients can seek care and expect to have it covered through these facilities for at least the 1 year time period, which, if that were to be passed, we would anticipate likely that this would continue, depending upon how things result. The Act to Defund Planned Parenthood, as mentioned just recently, has been given a basis for a time allotment of 1 year. This year will be granted, or depending upon how you want to look at this, designated as punishment to the Planned Parenthood Foundation, demanding evidence that the foundation go 1 year without a documented abortion as covered by Medicaid, i.e. using federal funds, before the consideration of before federal funding be reconsidered. Now, the interesting part to that is that, as we've already discussed in this presentation, Medicaid does not cover elective abortions legally by any means. So unless the allocated funds that are supposed to be covering preventative services are actually behind the scenes or behind the books, however you want to look at it, being used for abortive services, then this actually is not being violated. Again, this is not a new debate. This is something that has been fueling and in the works for some time. So this is really why it's important that we all become aware of both sides, really getting a good picture, because reading, as we've discussed earlier in this course as well, depending on which news source we're looking at for different kinds of information, you're going to see lots of different viewpoints and lots of pointing fingers. So is there a right or wrong? That's for you to decide. But it's important to note that these funds would be shifted to thousands of government-backed community health centers, which have been in debate. That issue has been in debate, as a majority of these centers are already overburdened. Again, not something that is new to our knowledge. All of us are nurses. We have a general idea of how community health centers are burdened now more than ever, with an anticipation that things will only continue to worsen. So let's talk a little bit about what Planned Parenthood is, what they do, just get a good basis for what exactly would be defunded. Planned Parenthood's a community health provider with affiliates in all states, provides family planning, women's health services, and some male services to most commercially insured patients and those with Medicaid coverage. Also, care affordable for those who are uninsured, which is helpful. Provides reproductive and other women's healthcare services to approximately 2.5 million a year. Over half of Planned Parenthood facilities are located in rural or medically underserved areas, and over half of Planned Parenthood patients have Medicaid coverage. Important considering what's going on in this policy. Planned Parenthood provides women with both affordable and prompt healthcare services, often offering same-day appointments and on-site pharmacies. This is huge. I think we can all relate to the importance of prompt service, especially when one is seeking contraceptive services and things like that. Planned Parenthood services go well beyond birth control coverage to include well women visits, cervical cancer screening, STI screening, testing, and treatment for men and women, HIV testing for men and women. Important to note that the estimated number of unintended pregnancies averted by Planned Parenthood contraceptive services each year is over 500,000. The estimated number of abortions averted by Planned Parenthood to contraceptive services each year is over 200,000. Percentage of all Planned Parenthood health services that are contraceptive services at greater than 30%, and less than 3% of services are for abortion. Percentage increase in Planned Parenthood men clients from 2002 to 2012 went up by 83%, and number of Planned Parenthood activists, supporters, donors, over 7 million. This pie chart helps give a bigger picture of what exactly Planned Parenthood does. At 35% contraception, 34% testing and treatment for STDs, STIs, and infections, 17% cancer screening and prevention. This includes cervical cancer screening, mammograms, 10% other women's health services, 1% labeled as, quote, other services, and 3% at abortion services. And these are going to include both elective and medically necessary or special case abortions. So who are the key stakeholders here? Women as patients, federal and state legislators, healthcare providers, community health agencies and departments, obviously the Planned Parenthood Foundation, pro-life or pro-choice organizations, depending upon stance towards the act. There are multiple key factors in this policy analysis, all of which are diverse, complex, and controversial. Some key political factors include the pro-life versus pro-choice debate, the liberal versus conservative disagreement, as in Democrat versus Republican stance, women's rights in general. Some social factors include, obviously, the gender equality, women's rights. Again, this kind of enters into a lot of key factor bullets here. Low income and rurally located women specifically targeted. Just a few to mention. Economic factors include devastating loss of health care, clearly. Indirectly impacts multiple areas of life, including education, ability to maintain and obtain job, economic security, the ability to live as a free and functional member of society. It's been estimated that 1/3 of wage gains that women have had since 1960 be attributed to access to contraception. Access to birth control has been associated with women obtaining more years of higher education, allows a woman to time pregnancies for a period of relative financial stability, thus decreasing the likelihood that she and her child will remain poor. Investigating in contraception saves government money long term. It's estimated that for every $1 the federal government spends on contraception, it saves $7.09, largely owing to the prevention of unintended pregnancy. This is a very favorable return on investment. Some practical factors to look into, clearly being unable to dismantle the act as one single individual, but as one single individual, one has the ability to speak to their elected representatives, seeking support from them, making their voice heard, being a personal or women's advocate. Some legal factors to consider include clearly the balance between public health and political gain, another huge factor right here, and I think we can all discuss this topic rationally, reasonably. Ethical and legal considerations. Another extremely important factor group to consider is quality of care. This should always be at the front line of any policy analysis, as quality of care is of top priority in nursing and should be in healthcare, period. Looking at two different sides, either supporting or opposing this policy. On the supporting side, we're looking at improving healthcare and quality of care by forcing Planned Parenthood to suffer at least 1 year without Medicaid funding in an effort to, we're looking at the big picture, removing abortion, period. Let's be completely transparent. Opposing would be reducing and hindering quality of care by stripping away Medicaid funding for all services provided by Planned Parenthood, including those for which are actually only covered by Medicaid at this point: birth control, cancer screenings, well visits, STI testing and treatment, and special case abortions. There are multiple options to consider here. The first option, support H.R. 354 to defund Planned Parenthood. The second, oppose H.R. 354 to be against the defunding of Planned Parenthood. And the third, to propose an alternative or balance to thereby reduce the burden placed on women with Medicaid coverage, such as promoting investigation towards the fungible funds that are allocated to Planned Parenthood upon filing for federal funding reimbursement, or, as already been mentioned, funneling support to other community services that are not affiliated with Planned Parenthood. This one has been proposed and mentioned by bill supporters, and I think the vagueness to the idea that just the money that was going there will be allocated to community services and community health departments and agencies can be realistic. But until there is an actual plan, a written plan that we can view and see and know that there are going to be resources in all the areas of which Planned Parenthood was formerly serving, this can be an option that's still not quite balanced. As we discuss some recommendations, I think it's important to cover some points in history that can sway one's decision upon their view of this policy. The experience in several states whose legislatures have denied public funds for Planned Parenthood is a cautionary tale of sorts. When politicians in Texas, for example, excluded Planned Parenthood from a state program serving low-income patients, the number of women using the most effective methods of birth control decreased by 35%, and the number of births covered by Medicaid increased by 27%. In Indiana, when cuts to public health funding forced many clinics, including Planned Parenthood centers, to close, rural areas of the state experienced one of the largest and most rapid HIV outbreaks the country has ever seen. It is possible to access to Planned Parenthood's free testing and sexually transmitted diseases may have curtailed this outbreak. As a woman, patient, provider, nurse, women's health advocate, I personally recommend opposing the act to defund Planned Parenthood, but do support efforts to minimize the misuse and illegal allocation of federally granted funds for non-life-threatening or elective abortion. This is something that is going to continuously be in debate when abortion is a legal service. This is not something that is going to purely vanish, and not without much turmoil or argument and policy breaking, policy forming. I think above all things, promoting preventative healthcare services is of utmost importance. In practice, nurses, nurse practitioners, nurse leaders, administrators, important for everyone to realize what would happen if the act is passed and becomes immediately imperative that community health center providers and primary family practice providers, community healthcare agencies, all work diligently to fill the gap, because we know that there is already a primary care and rural community care, even a women's health care provider gap, and it will become our responsibility to work even harder to fill the gap that will need filled. So not only is this important to individuals, men, women, patients, but also clearly to the healthcare world, providers, and nurses as a whole.